Hello. This anatomy lab, Biology 281, is on anatomical terminology and organ systems. You'll have a link to this particular laboratory directions. It'll be online, and so you can get that, and you can see that it's a very helpful thing because it'll have common anatomical terms. The reading isn't so as important as the way it's organized into tables, and also then you're going to see very nice diagrams. See, there's a diagram of the planes of the body and the sections and of the body cavity layout. Okay, more tables. So this can help you a lot, and you'll have this file on the computer, and so you want to take a look at that. That'll help you with this lab. And there we have some other helpers with this lab. The helper right back here is the skeleton, which you'll be seeing a lot of him. It is a him, and you'll find out how to tell whether a skeleton is a male or a female, and this is him, not in chauvinistic language. It just is a male skeleton. Okay. Now, one of the reason why I've got him here is for the anatomical terms of proximal and distal. Okay. The hand is at the distal end of the arm. Okay. As you move toward the torso, this is the torso region right here. As you move towards the torso, then you are going proximal. Proximal means next to, and distal means far from. Okay. Same way with the lower appendage. Probably, maybe can't get it. Well, maybe I can get it up here. Here's the lower appendage. So the foot would be what? Distal to the knee. The knee would be proximal to the foot. Distal means far, and proximal means near. So okay, we're done with you now. Move you a little bit out of the way. Thank you, sir, for helping out. Now what we have here is called the anatomical torso. Let me shove where I'm going to use both of them, but let me shove that one over like that, and this one right here like this, center stage. Okay, and let's take a look at the other anatomical terms. Okay, we did proximal and distal. If you're in the middle, that's called medial, and if you're on the side, that's called lateral. Okay. If you go up, that's called superior, and if you go down, that's called inferior. The front is called the anterior, and the back, anterior or ventral, and the back is called the dorsal or the posterior. See, posterior or dorsal, and then on the front side, this is anterior or ventral. Okay, so we got superior, inferior, we've got medial and lateral. Okay, and then we also have the right and the left. You got to remember things are reversed when you're looking at the specimen, because you are not talking about your body's right or left. You're talking about the right or left of the model or the specimen that you're looking at. That's another thing we need to do in this video is anatomical position. Anatomical position is face forward, palms facing front like this, palms forward, then feet together, okay, and in an erect posture. Other positions, that's the anatomical position. Body erect, feet together, hands facing forward, okay? That's anatomical position. So my right is on your left and my left is on your right. So you have to talk in terms of the position on the specimen or the model. So we've got anterior, inferior, medial, lateral, anterior in the front, posterior in the back, and we've got right and left. It helps to have those directional terms in anatomy. Now we also have to talk, there are three ways to section the body, okay? If you section it this way, this is called the sagittal plane. That's called, it divides the body right and left. That's called a sagittal section, okay? If you divide the body front and back, that's this plane. That's called the coronal or frontal section, okay? That's the frontal plane. And then if you do it inferior and superior this way, that's called the transverse or the cross section. So see, sagittal is right and left, coronal is front and back, and transverse is inferior and superior. And then if you section anything on an angle, that's called an oblique section. An oblique section. Okay, and you can see this guy has some of his organs out, so you can see his kidney back there. You can see the abdominal aorta and the inferior vena cava and the heart and the lungs. Okay, so let's okay, so we've talked about the different sections and the different planes. Now we're talking about the body cavity. This whole thing is the body cavity, okay, and it's divided by a big muscle that's right here. That's the diaphragm, is that big muscle, and the body cavity above that is called the thoracic cavity, and the body cavity below that is called the abdominal pelvic cavity. The upper part's abdominal and the lower part is pelvic, but there's no structural division there. Okay. So here's the whole body cavity. Here's the diaphragm crossing right here. That's the big breathing muscle. Above that is the thoracic cavity. Below it is the abdominal pelvic cavity. The top part is the abdominal region, and the bottom part is the pelvic region. Okay. Some other things, we might do a couple of regional terms. This shoulder area, these are regional terms. There's many of them, so we'll just do a few. The shoulder is called the acromial region. Okay. The neck region, is called the cervical region. Okay. The chest region is called the thoracic region. This down here, the lower back, is the lumbar region. Okay. Down here is the gluteal region. Okay. The chest region is the pectoral region. See? And then this is the abdominal region. So those are just a few regional terms, but you can see in your laboratory materials that there are many more regional terms, and you need to learn those as we go along. So that's this torso. Oops, very bad noise there, bad noise. This one's heavier, so he slides more smoothly, and he's got felt on the bottom, and he's a little bit taller, so I'll adjust the camera up just a little bit. Okay, then you know that there's different levels of organization in the body. The lowest level of organization is the chemical ones. Atoms bond together to form molecules. Molecules come together to form cells. Cells come together to form tissues. Tissues come together to form organs. Organs then come together to form organ systems, and then all the 11 organ systems in the body come together to form the organism. Okay, and so what we want to do here is look at some organs and talk about the organ systems that they're in. In the thoracic cavity, you can obviously see what? The lungs. Okay, the lungs are part of the respiratory system. Okay, and then we can take the lungs out. Whoops, there went the heart. Lost my heart over you. That happens with these models. The lungs are part of the respiratory system. The heart, he lost his heart. He just saw you and he fell for you and lost his heart. He gave his heart away. The heart right there is part of the what? The cardiovascular system. Okay. Then right below the diaphragm, this is where the diaphragm is, and above it's the thoracic cavity, and below it is the abdominal pelvic cavity. This would be the liver. Okay, that's the liver. It's part of the digestive system. Okay. Here's the stomach. That's part of the digestive system. Okay, and then here's the transverse colon. That's part of the large intestine. And then here's the small intestine. Those are all parts of the digestive system. You can see back here, well, maybe not. I'll show you this. There's the pancreas. Pancreas is an organ that has belongs to two systems. It belongs to the digestive system because it secretes digestive enzymes, and it also belongs to the endocrine system because it secretes hormones. And so that's just a little bit of the general anatomy that you can see on the torso. Let's go back to this. I want to see here's the lungs in the thoracic cavity, and the kind of circular thing that you see right down here, that's the diaphragm. Okay, here's something else you want to take a look at. You can take the abdominal pelvic region and divide it into 4 quadrants or 9 quadrants. You also learn that in lecture. That's so you can know where the locations of the organs are. Here's the organ systems, the chart on the organ systems. Now this is in that Carolina text that they supplied to us, but you can find it many other places. There's a video coming up on the dissection of the rat, and there's some information about that in here, about safety and about the dissection tools. So I hope this introductory video to the anatomical terms and the organ systems, I hope this will be a help to you. There's the rat down below with the dissection kit. You should have one of those to do your own home dissection.